the situation in Yemen was very, very difficult. Almost half of the population lived below the poverty line. The public services weren't functioning. And many people, about 16 million people, relied on aid to survive. So it was already a very, very difficult situation. I first visited in Yemen in 2012, and this was 1 year after the country's popular uprising. At that time, I interviewed women across the country, and what women were telling me was that they were losing any hope for their future, that they couldn't think about anything else but how are they going to put food on the table, how are their families going to earn an income. So the situation was already very desperate. And now that you have 6 years of war, it has been absolutely devastating for Yemenis. You've got 250,000 people that have died, not just because of the fighting, but because they haven't had access to food or health services and other things. And now on top of this, you've got a global pandemic. So now millions of Yemenis are looking down the double barrel of the global pandemic and starvation.
As you mentioned, COVID-19, even according to UNICEF, they're saying when it comes to that situation, compounded in Yemen, it's an emergency inside of another emergency. What do we know about how the country is managing in terms of things like keeping track of cases, as well as access to equipment?
So COVID-19 is spreading rapidly in all across Yemen. So when you look at the official figures, for example, I think it's like 1,269 official cases and around just close to 400 deaths. But, you know, the reality of it is there is such little testing in Yemen. There's very little testing kits. And then on top of that, what we're hearing is that hospitals are actually turning people away. Health workers themselves are very terrified. They don't have access to protective equipment, so the gloves, the face masks. There's a shortage of medicines in the country. So Yemen's health system has been devastated by war. It's not just near collapse, it's collapsing. The system is not able to deal with the situation. There's a new research modeling by the London School of Hygiene and Tropical Medicine, and they're saying already up to 1 million people may be infected already, and that up to 85,000 people could die. So this is an extremely concerning situation. And I think those people who have contracted COVID-19, so those official figures, the death rate is 5 times higher than the global average. So you can see how terrible it is.
So then it's confusing with a situation that dire, with that number of lives at risk. It's surprising that we're not seeing it more widely covered in a lot of media coverage. We've seen spikes of it popping up in social media in recent months, but obviously this is something that has been escalating for years.
Yeah, I mean, it's very difficult to get the true picture of what's happening in Yemen. And part of the reason for that is that journalists haven't been able to get into the country. And part of the reason for that is there have been heavy airstrikes, there's been fighting. Even when they've been able to get into the country, they haven't been able to access some of the worst affected parts of the country. So what you have is a terrible situation of hunger, starvation, devastation, and now COVID-19. And a lot of this is happening with the world not being able to see it just because the reporting isn't there.
And so then how has the country traditionally supported itself, and what could it potentially turn to now in this time of crisis?
Well, before the war, Yemen was not really fully integrated into the global economy. Oil and gas was accounted for 90% of Yemen's exports. So really, that's what they were making their money from. But the current situation is that because of the conflict, about 600,000 people have lost their jobs. You've got hundreds and thousands of teachers, health workers, and other public servants who haven't been getting paid. And then on top of that, Yemen imports nearly everything. It imports food, it imports medicines, it imports fuel as well. And that means that prices are also very high. So really, there's very little that Yemen's economy relies on. There's not much to make money from right now.
So then how are neighboring countries and allies trying to help economically?
So recently you had a donor conference hosted by Saudi Arabia, and now that conference raised, I think it was something like 1.3 billion. That's less than half of what's needed to meet the humanitarian needs in Yemen. So Saudi Arabia is also, as you know, a key actor in this conflict. And if you compare the amount of money that has been spent on fighting this war, so we hear figures like up to 1,000 billion that has been used to fight this war. This is nothing compared to the support that Yemen has received. Yemen's economy is on the verge of collapse. You've got a drop in the Yemeni rial. You've got prices of food going up because Yemen imports all its food. So in the past, in 2018, when we saw Yemen's economy about to fall under, what Saudi Arabia did was pump over 2 billion into the central bank in Yemen. Now that money is running out, and new money isn't forthcoming.